Good afternoon, everybody. My name is Tiziana Codenotti. I'm the president of Eurocare, the European Alcohol Policy Alliance, and I'm very pleased to welcome you not only on behalf of Eurocare, but also on behalf of the other organizations involved in the Awareness Week. As you know, the week is a joint venture. It's a joint initiative of Eurocare, of the European Association for the Study of the Liver, the European Liver Patients Association, the European Brain Council, the European Federation of Addiction Societies, and the United European Gastroenterologists. And in addition, we also have a number of other organizations who are endorsing this activity. And if you want to know, they are all listed on the website. And we are also very happy that this year's campaign has been organized in close collaboration with WHO Europe, with their alcohol team. So within the week, we have 3 webinars. The first one is today, and then tomorrow and Wednesday, the other 2. What we hope to reach with this week is a higher awareness of the need to address alcohol-related harm in Europe and highlight the need for an integrated approach to alcohol policy. In my notes here, I have some figures and estimates of alcohol-related harms, but I thought I will skip that because I think they will be addressed by our speakers today and highlighted by them. So I just wish to say that these numbers, these estimates are still very worrying, and that the harm caused by alcohol to the individual and to the society is still too high. So we need really to take action. So I told you that we have 3 webinars. The focus of today's event is the links between alcohol and cancer, which is such an important issue when speaking about awareness, and also when thinking about the connection with the forthcoming European Beating Cancer Plan. I think we really have a good political momentum here that we could use to really highlight the issue of the links between alcohol and cancer. And also today, in conjunction with this event, WHO Europe is launching its new fact sheets for policymakers, which is called Alcohol and Cancer in the WHO European region. So without any further delay, before I give the floor to our very impressive list of speakers, there are a couple of things that I need to tell you. First of all, we are recording this webinar and it will be available on our websites and on YouTube. So if you don't wish to your name to be visible later, you can click on your window and rename yourself just in case. And with the agreement of the speakers, the PowerPoint presentations will be available on the websites. If you have questions, please type your questions in the chat, and we will try to save some time and take at least 1 or 2 questions after the presentations. And please stay muted, all except, of course, the speaker. I'm very happy to introduce to you this very impressive list of speakers we have today. They all represent a wealth of knowledge, and we are delighted that they're willing to share their time with us. So I think I'm ready to give the floor to the first speaker, who is Nino Berdzuli, Director, WHO Regional Office for Europe, World Health Organization. And yes, I see his name. So please, the floor is yours.
Good afternoon. Thank you so much for introduction, and warm greetings from the WHO Regional Office for Europe in Copenhagen. I'm very delighted to have this opportunity to join you as part of the European Awareness Week in alcohol-related harms, and looking forward to have a very interesting discussion, of course, on the links between alcohol consumption and cancer and the evidence-based policies and the options to reduce the risks and the harms. I'm grateful, very grateful to the Eurocare and all project partners in alcohol awareness, not only for joining with WHO this week, but also for ongoing work to reduce the harms attributable to alcohol use across the European region. I'm also very grateful to the International Agency for Research on Cancer, our sister organization, for its work on and the collaboration in cancer research and its supports, of course, in the work related to the alcohol, including the production of this development of this new fact sheet that we will be launching today. WHO European Program of Work that many of you are aware was adopted in September this year by 53 European member states. And this is the agenda for 2025. And it is structured around the 3 interconnected strategic priorities, which include achieving the universal health coverage, addressing the health emergencies and promoting the healthier populations. A key focus on this agenda, is on tackling health challenges in a united way, working with all partners to leave no one behind. The European Program of Work places NCDs, non-communicable diseases, very high on its agenda. And this is not surprising. Of the 6 WHO European regions, the European region is the most affected by NCDs. And the growth of NCDs is a matter of significant concern. And COVID actually showed us how badly people living with NCDs are affected. If NCDs would have been before the pandemic and will be in the future better prevented and controlled, then more lives would have been and will be saved. So it is imperative to tackle the epidemic of the risk factors to better prevent and control NCDs. And of course, alcohol control measures in this regard play a key role in efforts to achieve the global goal of 25% reduction in the premature mortality from NCDs. And the reason for this lies of the fact that alcohol contributes to over 200 health conditions, the majority of which are NCDs. Including the cancer, the cardiovascular diseases, liver cirrhosis. And for most diseases and injuries caused by alcohol, there is a dose-response relationship. The higher the consumption, the larger the risk for negative consequences. The new WHO Europe fact sheet that we launched today, Alcohol and Cancer in the WHO European Region, an appeal for better prevention, emphasizes the causal link between alcohol use and the range of cancers, including some of the most common types, such as the breast cancer and the colorectal cancer. And it also makes clear that alcohol attributable cancer and deaths can be reduced through the implementation of the cost-effective policies, such as increasing the taxes on alcohol beverages, as well as the actions to restrict the marketing and availability of alcohol. We all are aware of infodemic, the vast amount of information around health, and the most damaging effect or the aspect of the infodemic has been false and misleading information from non-health actors. And as we all know, this has led to dangerous and unproven claims that being shared. As a former GYN oncologist, I had many women patients throughout my clinical career and the clinical experience who thought that a glass of red wine is good for heart and overall health. And it is not surprising that many women are still unaware about the link between the alcohol and the breast cancer. as this idea of safe level of alcohol consumption is still being promoted. So women and people in general have the right to know that there is no safe level of alcohol consumption for cancer, and that all types of alcohol beverages, regardless of their, are linked to the cancer, regardless of their quality and the price. So we still have much to do, despite some progress in reducing the harmful use of alcohol. The WHO European region continues to have the highest level of alcohol consumption per capita in the world. We need to have the revitalized commitment and support embedded into the implementation of the comprehensive national policies and the strategies to reduce the alcohol-related related harm. So we have to relentlessly continue to advocate for policies and the strategies that are known to reduce the alcohol-related harms. And this can be only achieved together through united actions. And I'm very much looking forward to continue advocating and working with you all on this. Thank you so much for this opportunity to speak, and looking forward to interesting discussion.
Well, thank you so much. I just read a question on the chat, and someone is asking, you mentioned the list of the 200 conditions in which alcohol is involved, and someone is asking about where to find them. Is there a list? Is there a website where you can check the more or less 200 health conditions you mentioned?
We will send this, so we will send the website through the chat. Yes, absolutely.
Okay, thank you very much.
Thank you.
Okay, thank you also for staying perfectly on time. So that gives me the opportunity to give the floor to the second speaker, who is Isabelle Soerjomataram. Sorry for the pronunciation. She's from the International Agency for Research on Cancer, and she's going to talk about the impact of alcohol drinking to the burden of cancer in the WHO European region. Please, floor is yours.
Thank you, Tiziana, and thank you also, Nino, for introducing this collaborative work. So my name is Isabelle Soerjomataram from the International Agency for Research on Cancer. This is a really, truly collaborative work, so I'm not going to take the credit myself. I'll acknowledge then all the collaborators later on. But in the next 10 minutes, I will be then presenting to you some of the main results that is available very recently now in the fact sheets. Please visit them, look at them. It's very short, it's very useful with a lot of information in different languages. So I'll start off with then repeating what was already mentioned. So alcohol causes cancer. This has been then acknowledged, proven scientifically for a lot of decades now through different studies. And then it has been now linked causally at least to 7 cancer types. These cancer types are then ranging from cancer then on the upper head and neck, for example, the oral cavity, but also then the back part of the respiratory system, like the pharynx and the larynx. Also then throughout the digestive system, from the tract that link then the oral cavity throughout then the intestinal, and then through until the end, then in your large intestines, the colon and the rectal. But then one cancer that is often unrecognized is also breast cancer, which is really a major important cancer in the European region. So looking into then the awareness of knowledge. So as mentioned previously, for the scientific world, it is then has been then confirmed that then alcohol is causing cancer. But then if we're looking into then the public population, the awareness is somewhat lower. So I'll give you just 2 examples. of then a survey that has been done regularly in France on the population knowledge of the causes of cancer. And then in this, for this presentation then on alcohol. So this survey is called Barometer Santé, and then I think the last one that I have is then from 2010. But then if you see the changes over time, actually the knowledge in terms of alcohol and cancer hasn't improved that much. So then in one of the examples, it was asked, do you think air pollution causes more cancer than alcohol? And then if you see then the population responses, people agree to this statement. So air pollution causes more alcohol. It's over than 50% of the population in France believe that air pollution causes more than alcohol, causes more cancer than alcohol. And only then 45% of the rest of the population disagree with the statement. Looking into another example, for example, it was mentioned before on then the relationship between alcohol and cancer. So again, here then it was asked, alcohol causes cancer if it's consumed a lot and for a long time only. And then the responses of the population is then, yes, it's only causing cancer if then you drink a large amount of alcohol and for a very long time, which is not true as then previously mentioned. For cancer, there is no safe limit of alcohol drinking. Well, then again, very similar proportion of the population think that the statement is wrong. So this is then one part of many what driven then the collaboration into then estimating the most recent burden of cancer that can be caused or linked to alcohol drinking in WHO Euro region. Here then you see then the differences between countries of the member states. You see then in some countries in terms of the incidence rate, so the number of new cancer cases per 100,000 of the population is somewhat lower in the southern eastern part of Europe, while then it's somewhere in the middle for then some of the northern European countries, and then it gets then to quite a high level in then the central European countries. So we see then differences by country. The other differences that we really see is then the differences by gender. So here then I'll show you then the proportion of cases out of all cancer cases in WHO Euro region for men. You see then in the eastern part of Europe, you see then large proportion of cancer can be caused or linked to alcohol. Over 6% of the total cancer there are related then to alcohol drinking, somewhat lower than in the southeastern part, also then some part of Northern Europe, and somewhere in the middle for the central part of Europe. If we see then the same result for women, there's a bit of a similar pattern in terms of the country. So then you see then some of the region of southeastern European women are drinking less than their male counterparts. That's also true, and then for some part of the northern European, and then somewhere then in the middle again, then for the central country. So by country, there's really a different pattern that you can see here, and also different pattern than by gender. But that said, at least 3% to 6% of cancers are related to alcohol use, which is a lot, which means also that we can do a lot to improve or decrease then the burden of cancer in the region. So we mentioned previously there's at least 7 cancer types that are then related to cancer burden. That is then confirmed strongly based on the scientific evidence. There's several other cancer sites there where then they're starting to come out and some new results where we don't include here, just to have then the most important and strongest relation. Then I'll show you then in terms of contribution of each of these cancer into then the burden of cancer related to alcohol in Europe. So we have around 180,000 cancer related to alcohol. If we divide this for male and for female, about 110,000 is then occurring in men. So it is a bit higher as then shown previously. For women, somewhat lower, 70,000 cases that are caused by alcohol. But then if we see what are those cancer types, again, this is then what probably surprises a lot of people who previously didn't even think that breast cancer is really a major contributor to cancer related to alcohol. So 45,000 cases out of the 70,000 cases of alcohol related cancer in women are then breast cancer. It's important, it's large. If we see the next cancer type is then the large intestine. So this is then the colon. So the first part of that large intestine causing around 36,000 cancer related to alcohol, followed by the end then of that large intestine. And after that also liver, oral cancer, which has been then discussed. Liver cancer, another important contributor, and then the rest of the cancer type. So this is really then to say, we think often that cancer cannot be prevented, but if we see then here, a big number of cancer can be prevented only by reducing alcohol consumption. So I think that's an important message. And just to conclude, so it is linked to at least 7 cancer types. Alcohol drinking awareness can be improved. So I hope then, for example, such webinar would help in improving that awareness. The burden are different then by countries and also by gender. And then if you then see later on in the presentation that comes, there's really real action that can be done to prevent this, to decrease the alcohol consumption that finally then will reduce the burden of cancer in these countries. So I hope this is useful. Again, this is a collaborative work of a lot of different people that not all I mentioned here. I put the link for the fact sheet there, but I'm sure that the organizer will put it then. But please see it, please use it. It's very short and it's very useful and full of information. Thank you so much for listening.
Thank you so much, Isabelle, especially for giving us that, colorful picture of really all those cases of cancer that really could be prevented by, just as you said, reducing or not consuming alcohol in the European population. Thank you. And now I give the floor to Carina Ferreira-Borges from the European Office for the Prevention and Control of NCDs. WHO Regional Office for Europe. And Carina will present us the WHO's new alcohol and cancer fact sheet. So please, Carina, the floor is yours.
Thank you very much. Thank you and good afternoon to everybody. Thank you to Eurocare for having and doing this meeting, and thank you to our divisional director, Dr. Nino Berdzuli, for opening this meeting. As already mentioned, I would also like to thank IARC as well as all the researchers that collaborated with us in developing, this report that we are launching today. It is, in our view, a very important report. It provides the facts which are needed so that we have a better understanding of the role of alcohol and in cancer. So I will, in my presentation, let's see if it works. First of all, I would like to start talking about the NCD office. So I work for the WHO European region, for the regional office for Europe, and I am based in the WHO European Office for Prevention and Control of NCDs. Why is this important? Because we look at alcohol, we look at other risk factors, but we have a very important role in terms of surveillance, and the surveillance which basically aims at supporting the efforts of the member states of the European region to reduce the heavy burden of non-communicable diseases in Europe. And this burden is very high. So if you look at alcohol from a public health perspective, we realize that The benefits that we many times hear about, you know, in terms of the production, in terms of the sales, in terms of its importance, and the use of this commodity come at an enormous cost to our societies. We know that alcohol is responsible every year for about 3 million deaths, which means 6 deaths every minute. And in the European region, we're talking about 1 million deaths per year. This is a huge number. And if we look at the way that these deaths are distributed, we see that those who are more affected are in fact the younger population, the younger generation, those who are most active and the most productive share of our society. So you will see here that this is, you know, the total of deaths, and you'll see that deaths are basically, the proportion is higher in this young generation. Some of the important key messages that I would like to highlight from our report. First of all, as already mentioned, alcohol is related to cancer and causes cancer, and is responsible for 180,000 cancer cases in the European region, and 92,000 deaths which are caused by alcohol. There is no safe level of consumption, and this is an extremely important message from our report. So we need to match the public health responses and respond in a way which is adequate in terms of, you know, what we know today in terms of scientific evidence on the risks which are associated to alcohol consumption. So Isabelle already mentioned, these are some of the cancers. These are the cancers which are caused by alcohol. So there is a causal relationship. It's not just, you know, some type of, you know, association. It's caused by alcohol consumption. And we see that they are distributed along the pathways. I mean, the ways that alcohol, you know, from the mouth till the rectum, colon rectum, and we see how alcohol is destructive in the body. We also see the proportion of cancer deaths per cancer types, which are attributable to alcohol consumption in our region. And as highlighted by Isabelle, we see, you know, devastating harm, you know, from especially for women regarding to breast cancer, but also to colorectal cancers. So, as I mentioned, one of the important messages of this report is that there is no safe level. From the first drink, we are increasing our risk of developing cancer. And this is about, you know, one glass, and the more you drink, the more you will increase your risk. So this means that if you drink up to a maximum of 2 drinks per day, so we're talking about 20 grams of pure alcohol per day, you have increased risk of developing these cancers. And you can see here that, for example, for the oral cavity cancer, you will have 9% risk of having oral cavity cancer. But if you look for women, you will see that very, what we would say, low levels of alcohol consumption in women. We're talking about 2 glasses of, you know, equivalent to 2 drinks. We'll have about a quarter of breast cancers in women. So other key message that we would like to highlight in this report is that alcohol attributable cancers can be prevented if we reduce the quantity of alcohol that we are consuming, and if we use effective policies that we know already work so well, such as increasing taxes, banning or restricting marketing, and restricting also availability. These are the well-known WHO best buys. We have documented these policies, and we have documented the implementation of these policies in the European region across the 53 member states in our region, and this data is available in the reports that we have published. We know that we have room for improvement, and I will come back to this. We have also conducted policy impact case studies. We have looked at the value of implementing these alcohol policies in terms of decreasing mortality in countries and in terms of what happens in life expectancy. So when we looked at the value of these policies, we found a very direct correlation between the decrease in alcohol consumption and the increase in life expectancy. And likewise, if you increase alcohol consumption in a country, you will for sure increase, you will increase mortality and you will decrease life expectancy. We have also produced some important reports in terms of, awareness of these risks. So we want people to know if they are going to drink, what are the types of risks that they are, in a way, going to have. So it is for this reason that it is important to have warnings on alcoholic beverages so that people can decide on and be informed of the risk when they are going to drink alcohol. There are other policy options which are important to reduce alcohol-attributable cancers. I already mentioned, the importance of having alcohol labeling as a way of informing people and raising awareness to the cancer risks, but also having policies which strengthen the healthcare response, having health professionals informing consumers about the alcohol and about the related risks. At the same time, all these policies will for sure contribute on our efforts as a society to promote health and to protect our future generations. As I mentioned already, and Jürgen, the next speaker, will talk about this, we know that the most cost-effective policies are the least implemented. And if we evaluated how these policies are implemented in our region, we see that for the 10 areas which are part of the European Alcohol Policy Action Plan, we know that the 10 areas that we have, pricing is the one where we have least implementation and therefore where we have more room for improvement in terms of the policies that we know work and should be implemented. So we know that alcohol became affordable due to the lack of these policies, became more affordable in the WHO European region over the past 30 years. And of course, this will have an impact in terms of the consequences and to the health and to the society as a whole. So reducing alcohol consumption is a public health imperative. Alcohol is not an ordinary commodity. The evidence of alcohol's role in cancer development and deaths has not been sufficiently recognized and addressed, both at the global and European level and in the responses that countries put in place. Therefore, to promote a better health and well-being, it is really important to have very clear measures. The first one is a clear message that there is no safe level of drinking. Then it is also important to have concerted action, both at national level, at regional level, and at international level to make sure that we all speak the same language and that everybody is aware of the risks that we are facing. Increased levels of political commitment and implementation of the 3 WHO best buys are extremely important to achieve results, as well as an effective coordination of multi-sectoral efforts. We know that this is not just about the health sector, this is about also bringing on board the economic sector and of course, finance at the ministry level. We need to combat the influence of vested interests, which oppose to alcohol, strong alcohol control policies. And we have also to have an appropriate and widespread engagement of public health-oriented non-governmental organizations, professional associations, and civil society groups. And therefore, we're very happy to see many of them here represented today with us in this panel. So I will end my presentation here, and thank you very much. You're muted, Tiziana.
I'm sorry, I didn't realize that I was still muted. I just was saying thank you for your presentation today and for sharing this new report with us. I don't see any questions so far, so I will just move to our next speaker, Rehm from the Institute for Mental Health Policy Research and Campbell Family Mental Health Research Institute, as well as from the Center for Addiction and Mental Health in Canada. He will talk about how many cancers can we prevent when increasing alcohol excise tax, which, as it was just mentioned by Carina, is one of the alcohol policy that has shown to be effective. So the floor is yours, Rehm. Thank you.
I had to unmute my speaker, I'm sorry. Thanks a lot for the invitation. And I will also present slides which are the product of a collaboration with IARC and with the WHO European region. What we try to do is we try to look into how many cancers can we prevent, avoid, when we increase alcohol excise taxation. And for some reason, yes, we have already seen the scope of the problem and the cancers caused by alcohol. Now, for all of those cancers, there are dose response curves. It starts at 0, and it has been already stressed that it is not possible to drink without any risk of cancer. Each drink does incur some risk of cancer. And those dose response curves can be usually seen by a relative risk starting at drinking very, very small amounts, like 10 grams, like 5 grams, going up to, of course, to the 150 grams, which is about the highest which people tend to drink with average sizes. And you see that the relative risks are relatively different. If you look into the oral cavity cancers, you see that the relative risks start going up pretty quickly. You are very quickly at 5, 10. The scale is the important thing. If you go into breast cancer, you see that the curve is much slower. It, at the end of the day, is at 4 or 5 only, where for the same amount of drinking, you have much a higher risk of oral cavity cancer. This is also one of the reasons, the slowness of the curve, how many of the cancers are actually due to heavy drinking or to less heavy drinking. So you can easily see that in the curve. If you reduce your drinking by 25 grams a day, 2 drinks in most European countries, 3 drinks in the UK, you reduce your risk by 1/3 from 15 times that of an abstainer to 10 times that of an abstainer for oral cavity. If you reduce it further to about 2 drinks a day, your risk will be 2 to 3-fold the risk of an abstainer. Your cancer risk can thus be substantially reduced by drinking less alcohol. But it's of course best if you drink no alcohol. So for cancer, if you want to achieve the maximum amount, no alcohol is best. So what would happen if we increase taxes by different amounts? And this is alcohol excise taxes. We used 4 countries of the WHO European region: Germany, Italy, Kazakhstan, and Sweden. And now it says increasing current excise duties by 20%, by 50%, by 100%. That sounds a lot. It is not. Overall taxation levels in Europe are pretty low. And in the EU, they're also very low. And overall, and I will show you with an example of Finland, a country which has a little bit higher levels of taxation. within Europe, a lot can be gained. And so if we increase excise taxes by 100%, usually the price in most countries will increase by less than 15%. So we are not speaking about huge price increases, just taxation increases. But you see here that depending on the size of the country, you can actually achieve public health gains. In Germany, you would avoid 673 deaths every year. Or sorry, these are new cases. We've done the same for deaths, of course. If you just increase taxes. And if people would go to the taxation rate of Finland, Finland is a normal EU country. It's a high income country. You would avert 1,600 new cancer cases in Germany. That is a lot. 1,600 new cancer cases in Germany is a matter of huge public health importance. And you don't do that by some strange calculations of statisticians who try to invent stuff which is not realistic. No, this is very realistic. This would just mean that Germany would have to adopt the excise duties of another EU member, i.e. Finland. So not a lot of effort. And that also means that the EU could, of course, increase their minimum tax level, thereby increasing the chances to prevent cancer cases within the whole EU. And the EU can set minimum taxes for all countries. I'm just leaving it to Germany. Obviously, Germany is the biggest country, so we would have quite a lot of cancers averted. But you see with the other countries that they also could avert about 4 to 7, 8% of their cancer cases every year just by adopting the Finnish taxation system. So what are the conclusions? Alcohol taxation is relatively low in large parts of Europe, especially in the EU. Increases in excise taxation for alcohol would lead to marked public health gains in cancer, but also for other chronic diseases and injuries. Obviously, if you increase taxation, you would also reduce liver cirrhosis. You would also reduce injuries. You would reduce some of the heart diseases overall. So we did not model anything extreme or unrealistic. Adopting the taxation level of an EU country would already lead to thousands of cancer cases averted. Even changing the current system of taxation to a system where you automatically adjust for inflation would save a lot of cancer cases. So there's no excuse to have such low and inadequate taxation systems in Europe for alcohol. It's a special commodity. European countries pay a lot for alcohol, and just increasing taxations a bit would not only reduce the cancer, it would also reduce a lot of other mortality and increase the financial incomes of countries, so at least some of the alcohol attributable burden could be balanced. Thank you.
Thank you very much for your presentation. Very clear and very straightforward. I do have a question for you. And the question is, if minimum unit price would have the same effect that you are describing as with the excises, with the taxation, would that be possible to have the same effects?
Overall, of course, it depends on how high the minimum unit price is being done. As with taxation, it depends on the minimum unit price. What is currently discussed in most countries is a relatively small minimum unit price, basically the equivalent of the Scottish minimum price, which had been calculated to avoid burden of the year 2012. Well, if you know a little bit about 2012 and 2020, you know there's huge inflation in between, and people in Europe are actually earning way much. So the minimum unit price has been decreasing in their effectiveness. So if we have a minimum unit price, which is that low, it cannot have the same effect in Germany. If we have a minimum unit price, which is much higher, we could get closer to that. However, let me stress one thing. A minimum unit price has been mainly done for preventing the effects of heavy drinking. With cancer, we have a situation that the effect of alcohol, the causal impact, is starting already at very small doses. One drink is increasing, 1 drink a day for female is increasing their chance of breast cancer. And of course, this leads to effects which cannot be used by minimum unit pricing alone. Secondly, it's not an either minimum unit price or taxation. It should be both, for both kinds of harm. For the harm which is actually going up in a steady curve, and especially for the harm of heavy episodic drinking. Sorry for being so long.
No, it was perfect. And thanks for the clarification. And thanks also for highlighting the connection and the need of both taxation and minimum unit price, which probably have different aims, but they are all both needed to try and reduce alcohol-related harm. Thank you very much. And I would now go to our next speaker, Marcus Beck from the United European Gastroenterologists. He is talking about alcohol and digestive cancer, a need for action. Please.
Yeah, hello everybody and welcome. I hope you can hear me.
Yes, we can.
Very good. Yeah, my task today is mostly digestive cancer. Liver cancer will be covered by Alejandro, who will come after me. So UEG, who are we? We are a scientific nonprofit organization combining European medical specialists and national societies concerned with digestive health in general, not only alcohol. So we have around 30,000 specialists from every field in digestive health, and we are promoting science, research, education, quality of care with the aim to reduce the burden of digestive diseases and improve digestive health. This is our mission. Now, digestive cancers, why actions are needed. I think this was actually highlighted by all the talks before me, but I will confirm it. Digestive cancers, including esophagus, stomach, pancreas, liver, small bowel, or colon cancer, affect both men and women and are the leading causes of cancer-related death in Europe as a whole. Evidence shows a direct correlation between drinking culture and higher cancer risks, with heavy episodic drinking being associated with a high incidence of digestive cancers, as Jürgen Rehm just nicely showed to us in his curves. Now, if you look at the global ranking of causes of death from the Global Burden of Disease study, you do see that, of course, lung cancer up here is the leading cause of death, but then liver, stomach, colorectal are the next most common causes of cancer-related death globally. And also when you look at the increases, for example, liver goes up from here to here over the period of 20 years. Now in Europe, it looks slightly different because liver is not as prevalent, but colorectal, as shown by a previous presenter, is a very important cause of cancer-related death, and it is at least partly related to alcohol. So statement, UEG issued a statement on Europe's Beating Cancer Plan roadmap because UEG welcomes the importance given to developing a cancer plan at the EU level with particular focus on prevention, lifestyle choices and health inequalities. So alcohol is one very important thing, but also of course healthy nutrition, which goes along with it, is very important here. Digestive cancers are at least partly preventable. Hence, a shift of focus from treatment to prevention is really essential. And this is something also for us doctors that's a bit new, at least in some countries. The Nordic countries, there always has been a lot of focus on prevention, but in Central Europe, not so much. Therefore, we would like to highlight the following points. European region has the highest level of alcohol consumption in the world. I think this has been nicely shown also by WHO Europe. There is currently no known or established level of safe alcohol consumption when relating to cancer risk. Several speakers alluded to that. Limiting the availability, affordability, and acceptability of alcohol is crucial. So we just saw the presentation of taxes and the discussion about minimum unit price. I think very, very important. But of course, it's also very important to have a reduction in advertising of alcohol, very important. TV advertising should be banned and so on. And delivering a regulatory approach to labeling to ensure that consumers are well informed about what they put into their bodies is also very important. Now, liver cancer, I will not touch here because it is important, but Alejandro will talk about it. Colorectal cancer is the second most common cause of cancer-related death in Europe. And there is a 21% increase of colorectal cancer in those who consume 1 to 4 alcoholic drinks per day, and as much as a 52% increase in those who consume more than 4 drinks per day. There's need for the implementation of standardized population-based screening programs for colorectal cancer in all member states, and UEG has been advocating that actually quite successfully over the last several years. But while there is a recommendation from the EU on cancer screening programs for colorectal cancer, implementation is not uniform across the region. And we need regular updates of the European colorectal cancer screening guidelines and screening progress reports every 2 years. And this is something that we're working on, and I know the EU is working on as well. Now, when you look at here at the data from a very recent meta-analysis on alcohol and colorectal cancer risk, 16 studies of almost 15,000 colorectal cancer cases and as many controls, you can see that there is not entirely clear what light consumption really means, but definitely starting with moderate consumption of alcohol, you do see a significant increase over all the studies. And as soon as you get to heavy drinking, of course, there's an even stronger increase in colorectal cancer risk. So I think this supports the data that have been shown by Jürgen Rehm and others. Further action on digestive cancer screening is needed. Esophageal cancer is not the most common cancer, but the fraction of esophageal cancers that is actually related to alcohol use is particularly high. In particularly, if you look at the proximal squamous cell esophageal cancer, that there's a very strong correlation with drinking of alcohol. And it contributes to nearly a third of alcohol attributable cancer deaths in men. Heavy drinking also causes a 21% increase in the risk of gastric cancer, even though gastric cancer, fortunately, as a whole, has been declining since World War II. Gastric and esophageal cancers are characterized by a particularly bad prognosis, overall 5-year survival not exceeding 25 or 10% respectively, because oftentimes diagnosis occurs at a very late stage. So we need to focus future research projects on the harm and benefits of both gastric and colorectal cancer screening programs, and of course taking alcohol consumption into account when you look at risk groups is something that needs to also be addressed here. filling existing knowledge gaps through increased funding into pancreatic cancer research. Now pancreatic cancer is a particular problem because it's so deadly and there's so little progress here. So drinking alcohol is associated with pancreatic cancer in heavy drinkers, 4 more drinks a day, with binge drinkers reported to have a significantly higher risk. And with a 5-year survival of less than 10%, pancreatic cancer is the deadliest of all these cancers. So we need more funding for pancreatic cancer research, basic science and clinical study, and this should be supported by the framework program. Through appropriate action, UEG thinks the burden could be reduced. With 135,000 alcohol-related cancer deaths predicted by 2035, and even moderate drinking having a significant impact on increasing the risk of digestive cancers, it is more vital than ever for government action and intervention to reduce the harmful use of alcohol. There needs to be a shift in attitudes towards social drinking to address the complacency concerning the negative effects of alcohol and change the general lack of awareness about the impact of even moderate regular drinking on digestive cancers. So thank you very much for this. This is what UEG wants to contribute here, and I want you to know that UEG is working here in order to make some progress. Thank you very much.
Thank you for sharing with us your perspective about what needs to be done in terms of reduce. Sorry, I was muted. I said thanks again, Marcus, for sharing with us your perspective and how your organization thinks that things should be done to reduce the burden of cancer in Europe. And now let me see if I have a question, not directly, so I'll just leave it there. And I'll give the floor to our last speaker, who is Alejandro Forner from the European Association for the Study of the Liver. Please, the floor is yours.
Thank you very much for your kind invitation. And in the next 10 minutes, I'm going to discuss some issues regarding the relationship between alcohol and liver cancer. And I always like to start my slides with this slide that basically shows the 10 most common cancer in the world. And you can see here that obviously lung, breast, and colorectal cancer are the most frequent, but you will see here that liver cancer is considered the 6th most frequent cancer in the world. And now we have data that this is the cause of the 2nd or 3rd cause of death due to cancer. And I try to convince you that the very important relationship between alcohol and liver cancer. And first of all, this is clear that alcohol is a very strong and well-known risk factor for disease development. The first point that I would like to stress that liver cancer appears mainly in patients with liver cirrhosis, and then if you have a chronic liver damage due to chronic hepatitis or due to chronic alcohol intake, you will develop chronic liver disease. At the end, you will develop liver cirrhosis with all the complications associated with liver cirrhosis that this is not the time to discuss with all of you, but we know that liver cirrhosis is the main pre-neoplastic condition to develop liver cancer, and therefore this is a clear relationship between the alcohol consumption and the development of liver cancer. But also there are very strong data that also suggests that the ethanol consumption is able to produce DNA mutations that leads to cancer development, not only liver cancer, but also all the cancer that has been discussed in my previous speakers. And this is clear that alcohol, not only by the development of liver cirrhosis, but also by direct damage of DNA, is able to develop or to help to develop a liver cancer. And also, and this is like I think is very important, this is the geographical contribution of alcohol in the liver cancer development. This figure clearly shows that if you review in Europe, between 20% to 60% of liver cancers are closely related with the alcohol consumption. Also, there is clear data that not only alcohol by itself is able to develop liver cancer, we know that also alcohol consumptions increase the risk of liver cancer when associated with other risk of liver cancer. For instance, we know that patients with chronic hepatitis C or chronic hepatitis B, they are a very high risk of liver cancer. But if you have an additional alcohol intake in this population, the risk of liver cancer increased 2 or 3 folds. Also the same with the obesity and diabetes and the metabolic syndrome. There are clear data that if you associate the metabolic syndrome, that is a clear risk factor for liver cancer, with chronic alcohol intake, the risk of liver cancer increases 2, 3, even 4 times. Also, we have to be very aware that also alcohol-related liver cancer is associated with very worse prognosis. Again, we have to keep in mind that patients that they are alcoholics, they are usually patients with a very low social level. There are patients with a lot of associated comorbidities that obviously difficult the treating this mortal disease. And also, we know there are a lot of strong data that those patients that they have an alcohol-related liver disease, they have less access to the hospitals, less access to the screening programs. In some of them, the screening is difficult by the steatosis of the liver. And finally, once the liver cancer has been diagnosed, due to the alcohol-related comorbidities, for instance, the cardiopathy, for instance, the social impairments, they cannot be treated appropriately, and there are a lot of retrospective studies that have clearly shown that those patients that they have liver cancer associated with alcohol, they have a significantly less survival compared with patients that have liver cancer related to other conditions, for instance, chronic hepatitis. And finally, and I think this is the most important topic that I would like to discuss with you and has been presented and has been discussed by my previous speakers, that clearly alcohol is a preventable risk factor for liver cancer. We know, as I have said, that the chronic liver disease is the major driver for liver cancer development. We clearly identify the risk factors for chronic liver disease. We know that chronic hepatitis B and C are the strongest risk factors for development of liver cirrhosis. But we now, since we have the universal vaccination for HPV in Europe, probably this etiology of chronic hepatitis B will disappear in the future. You know that now we have a very effective treatment for hepatitis C. You know that we have the WHO has the goal of eliminating the hepatitis C in 2030, and probably in the next 20, 30, 50 years, the risk factor, the chronic hepatitis C and chronic hepatitis B will disappear as a risk factor for cirrhosis and liver cancer. But obviously, we will have the alcohol and we will have the obesity as a risk factors for chronic liver disease. And this is clear that we have a lot of strategies to decrease the alcohol consumptions. All my colleagues, they have expressed that obviously increasing the alcohol taxes will decrease significantly the risk of cancer at all, in particular the liver cancer. And this is clear that we have to increase the intervention in the behavior, to regulate the density of alcohol outlets and reinforce the laws against the privatizing the retail sale for alcohol. And this is just only the summary, the take-home message of my presentation. This is clear that alcohol is recognized as one of the most important risk factors for disease development, particularly in Europe. As I have reviewed the figure, in Europe, this is clear that between 20–60% of patients with liver cancer, alcohol is a very recognized factor for the liver cancer development. This is clear that alcohol consumption leads to the development of liver cirrhosis with all the cost and the deaths that is associated. But obviously, we know also that alcohol is related with liver cancer. And also we know that patients with liver cancer associated with alcohol, they have significantly poorer prognosis, are patients that usually the early diagnosis is delayed. basically because they have lower access to the health system. They have also associated comorbidities. The people with abuse of alcohol, they used to have other diseases, not only the liver diseases. And we have to be aware that there are also social barriers that limit the access to effective therapy for those patients with liver cancer associated with alcohol abuse. And this is clear and has been repeated several times during this hour that alcohol is a clearly preventable risk factor for the disease development. And this was all the things that I wanted to discuss with you related the clear role of alcohol in the development of a lethal disease that is liver cancer, that, as I have said, this is the 6th most frequent cancer in the world and one of the most important causes of death due to cancer worldwide. Thank you very much for your attention.
Thank you, Alejandro. It was very important for us also to have the perspective of, you know, a specific issue dealt by health professionals like you in a very specific area of the liver cancer of the liver. And I think the role of health professionals is really crucial here to help us, you know, spread the message and to raise the awareness that alcohol is really, really an important risk factor that can be prevented from a health perspective. So thank you again. So we have come to the end of our speakers, and I am supposed to draw some conclusions for this hour together. I think many very interesting things have been said during this hour. Things that we could definitely use for our future actions. I'll try to summarize one of the things that have been very important for me. The first message that we should be able to really get through and have people understand is that what was repeated many times by the speakers, that there is no safe limit of alcohol consumption if you want to prevent cancer. It looks like a simple message, but it is not really a simple one. And we should really speak with one single voice and try to get the message through, which, as we all know, is not so easy because of many reasons, including the influence of the economic operators on trying to, you know, avoid that the message gets through. And of course, this is something that both the health professionals and the civic society and all the organizations involved could help deliver. Then also reference to WHO best buys has been made. And we have been known now for years that those are the alcohol policies that should be implemented. And we had, with the presentation by Jürgen Rehm, a very good example on how one of the best buys is, so interventions with price and taxation, how that can really have a tremendous impact on the reduction of alcohol-related cancers. It was also mentioned that the citizens' awareness and the citizens' knowledge of the links between alcohol and cancer is still very low. I think the reference was made to some surveys which are now 10 years old. So what we would probably need is an update of these surveys, which could tell us how really citizens perceive the relationship between alcohol and cancer, and maybe try to implement national or international campaigns in order to give the citizens more information on this. And speaking about citizens, consumers' informations, also labeling was mentioned at least a couple of times by the speakers. And this is an issue that is particularly dear to Eurocare because we have been working on labeling for a long time. And the fact that now we speak also about health warning and the fact that the citizen should be informed on the harm that alcohol can make on their health in relation to cancer. I think it's also very important. So I think we should pursue the issue of labeling, not only in terms of ingredients and nutrition, but also in terms of health warning. There is also, it was also mentioned by a few speakers, the need of have more data. So the support for new research is probably needed, but also the fact that there is a causal relationship between alcohol and cancer. And that's another message that I think it's very, very important that we manage to get through. As I said at the beginning, we probably have a good political momentum now for the Europe Beating Cancer Plan, as I said at the beginning. Also, the publication of the WHO new report is really a tool and an instrument that we have to use to really keep the issue of alcohol and the connection with cancer high on our activities and possibly also on the political agenda of the European Union. So that's basically what I wanted to say as a conclusion. We have a few minutes left, like 4 minutes, and I'm looking at the chat if we have, I see more of comments rather than questions. So if nobody has anything really, really urgent to add, let's see, new message. Okay, again, more messages than questions. People are talking about the importance to get the information also through the schools. So that would open a huge issue of, you know, education and training, but we will keep that for another webinar in the next future. I just want to close this meeting by thank you very, very much to the speakers for devoting the time in this webinar with us. I would like also to thank all participants and also Eurocare's Secretariat and all the other organizations for the efforts in being able to organize these webinars in such difficult times we are living these days, all of us on a global level. So thanks again, everybody. And we hope to see you not only in the webinars tomorrow and Wednesday, but also remember the Alcohol Awareness Week will be organized next year in November, usually the 3rd week of the month. So we really hope to see you again there. Thank you very, very much and have a good evening.